So I'm Jessica Pruente. I'm one of the pediatric physical medicine and rehabilitation faculty at University of Michigan. And today I'm going to talk with you about this iAcquire study that we're happy to be a part of. And today we don't have any results yet, so I'll just kind of introduce you guys a little bit to the methodology here, how the study was designed, why it was designed that way, because we'll really be talking today about an early look at early intervention for kids who have had a neonatal stroke. So a little bit of background information. Perinatal ischemic stroke affects about 1 in 1,150 live births. And this is defined as a stroke that occurred either presumed prenatally or within the first 28 days of life. Presenting symptoms are often seizures, muscle tone abnormalities, or encephalopathy. The impact is actually about 3,000 babies or 3,400 babies impacted every year in the United States of America, and about 64,500 babies worldwide. So pretty large population. When you compare and contrast, adult stroke has all these treatments, and adult stroke has had some really nice studies looking at constraint-induced movement therapy, or CIMT. But perinatal stroke has maybe even better evidence for treatment with constraint-induced movement therapy. For example, infants are still developing skills. So an adult goes into recovery from a stroke with a different mindset, right? They're trying to recover a skill that they have lost, whereas infants are just developing. Everything that they are learning is new. Infants also have a higher level of neuroplasticity. So the earlier we intervene, theoretically, the better outcomes that we can see, and long-lasting outcomes that we can see with our interventions. There's also this theory that infants who are having an impaired or a hemiparetic limb will have increased frustration when they're trying to use that limb, leading to more profound neglect, which becomes even more difficult to treat as the infant becomes older. So typical interventions, as a pediatric PM&R doctor, I get referred kids who have hemiparesis, whether it's from a stroke or asymmetric PBL, et cetera, right? And so we write scripts, physical therapy, write scripts for occupational therapy, maybe a splint so that they can get their thumb out into a more neutral position, maybe some muscle tone management if it's needed. But wouldn't it be nice if we could do better? Wouldn't it be nice if we could be more specific? If we could intervene specifically with a dose, with a frequency, with a modality that's going to have the best evidence for it to create the best outcome and create the best chance for these children to really excel later in life. And so that is what iAcquire is trying to do. And so why we think it works is multifactorial here. So one thing is that we provide continuous constraint to the non-hemiparetic upper extremity. And the thought that this does two things. One, it forces attention over to the hemiparetic side because the one side is casted from the fingertips all the way up. We also lower competing sensory motor input from the non-hemiparetic side so that the brain is really focused on the extremity that they have free and able to use for the period of time of the study. It also over time, not initially, but over time reduces frustration and fatigue with using that arm because it becomes the only thing they can use for the period of the study. So again, not initially, but as they get used to having the cast in place. And then we increase new developmental and practical skills. And so this is why we think it helps via neuroplasticity, is that by doing forced use of this limb at a very high dose and a high intensity, we can stimulate synaptic growth, create more efficient neuronal pruning to help improve brain laterality and maturation in the motor cortex and the corticospinal tracts. And there's some really interesting animal models, right, from Dr. Friel's work, looking at what happens to those corticospinal tracts after you do adaptive treatments with CIMT that shows new ipsilateral and contralateral corticospinal tracts developing. And so that's what our study was designed to look at. So the iAcquire trial is a randomized controlled trial of constraint therapy for hemiparesis after neonatal ischemic stroke in infants between 8 months and 3 years old. And so one of the first studies looking at infants with constraint therapy, not older kids or not adults, and how they did it is a little bit different. So one of our research aims is to actually look at which dose is most efficient or which dose has the best results. And so our high intensity group receives 6 hours of constraint therapy, 5 days a week for 4 weeks. Actually, it's 3.5 weeks. The last 3 days of the study, they take the cast off and they do bimanual integration. The medium intensity group gets 3 hours of that same therapy paradigm. And usual and customary care group can receive anything that's less than that. And so that would be more their standard early on PTOT or their outpatient PTOT once a week. They're looking at a lot of outcomes in this study. So emerging behavior scale, the mini AHA, the GMFM, the Bailey-4, the MacArthur-Bates communication inventory, some parental stress measures, parental report of therapy, and also the parent council is providing feedback through as the study has been going on. 2 other things they're doing, which I think our other researchers who have already presented today, is one is we're correlating the examination findings and research findings with neuroimaging. And so to be a part of the study, we have to be able to have an MRI scan. The other thing we're doing is actually looking at genomics. So we're collecting saliva swabs. So we're going to be looking at outcomes and if different genomic markers might be better predictors of which kids will be more successful with this type of treatment. Our timeline is to look at an immediate post-treatment outcome and then 6 months and 12 months. These are all the sites that are participating. So this is an NIH-funded study through StrokeNet. As you can see, there's a lot of sites participating. I can't take any credit for the design of this wonderful study. That was all Sharon Ramey and this core team here, which has been represented mostly out of Virginia Tech, but also Case Western and Nationwide Children's. The last thing to mention here is the intervention itself so as I mentioned, very intense, 6 hours or 3 hours with the cast in place. And then our therapists actually have to go down and get trained with exactly how they should interact with the kids, to use a lot of operant conditioning, and to make the treatment, A, seem really fun because these are small babies that we're doing this treatment with. But B, how do our therapists use the right skill set in order to make sure that they're maximizing the neuroplasticity and the potential outcomes with the treatment? So I'm actually fortunate here that 2 of our therapists who are doing the study with me are here today. So people do have specific questions about what that looks like. They would be more qualified to answer that than myself. So that is a brief wrap of the iAcquire. So far, we have enrolled 127 participants. We are still enrolling. Our site specifically is only enrolled about 6. And so we are actively enrolling and treating kids right now.